Okay, there we go. Over to you, Tracy.
Okay, thank you, Neela. Hello, everyone. My name's Tracy Lyons. I'm a medicines optimization and sustainability pharmacist down in Dorset. And I'm delighted to be here tonight to just give you an overview of a project that we've run in Dorset. And it's all about reducing medicines waste in our system. But I'm particularly delighted to be here because it feels like it's come full circle, because this whole project was generated from learning that I took from a CSH course back when I first started my road into sustainability. So it's really nice to sort of present to you what we've learned, because it was all generated from the CSH. So this is lovely. So our campaign was called Only Order What You Need. And it was really because we looked at our system and we had a huge issue with medicine spend, medicines use, and we just thought, like, how can we make sure that we're not depriving patients of medicines they need, but we get rid of medicines that are wasted. And I'll just give you our headline outcomes to start with. So the campaign was run over 2 months at the start of this year. And it was a patient education campaign that we ran across the whole county, and I'll explain what we did in a second. But these were our outcomes. So let me make sure my slides are working. Yes. So we looked at the number of repeat prescription items that were issued last year in February, March, so in 2023. And then we looked at our expected number of prescriptions for this year, for February, March 24, based on our prescription growth percentage. And we expected that number to go up by about 2%. Actually, following the campaign, this didn't happen. We didn't see that growth. And actually, we saw a slight degrowth of 0.7%. And that equated to about 65,000 prescriptions that weren't requested by patients over the course of the 2 months. And the knock-on impact of this in terms of carbon emissions was 295 tonnes. Our system avoided £475,000 worth of prescription spend, which was just huge. And you can imagine, part of my job as in medicines optimization is to make our system financially sustainable as well as environmentally. So that was a huge boon. Especially considering our overall outlay for the project was just £7,500. But there were also more intangible benefits that have really benefited our system. And that's things like we estimate that this saved over 1,000 hours of healthcare professional time in primary care. And if you want to translate that into a measurable metric, that's the same as 6,500 GP appointment slots. So it's just huge. And we also asked our GP teams and community pharmacy teams that benefited from this to then focus on activity which we know reduces medication error, which keeps people safe, which stops them going to their GP or their hospital. So further benefits the system and the environment. So yeah, a really fantastic outcome. So I will tell you now how we got to this stage. So our drivers for change, I'm sure you'll all be aware, is, we had to start looking at the finance. We're part of a medicines optimization team. We need to keep our local NHS team as sustainable as possible. But we were talking about how we did that. And then actually it was the learning about principles of sustainable healthcare that really helped us generate the idea for this. So we said, what we want to do is reduce waste, because we know from the National Overprescribing Report that about 1.6 million items per year in Dorset were being wasted. And we also said, the way that we can do this is to empower our patients. So again, going back to those principles of sustainable healthcare. And we really thought long and hard about how to roll this out, because, only order what you need is not a new subject matter. It's been done before, but we just think actually some of the processes that we used really helped us engage with patients in a meaningful way and get the message across to them. So when we were designing our campaign, we really thought about, we have a limited budget, we're a really small ICB. Where are we going to put most of our time and resource investment? And so using our prescribing system, which is System 1 in Dorset, but other prescribing systems exist. We were able to look at, on the left, the age bands of our patients in blue and the number of repeat prescriptions that they had on average. So you can see it varies age band, but it meant we could really target our resources and our interventions. And then also on the right, we ran the same exercise looking at our patients and the number of repeat prescription items they received per primary care network. So in Dorset, there are 18 of them, and these bars represent the different primary care networks. So you can see the repeat prescription numbers really varied per PCN. And it meant that when we were working out where to send, most posters, most adverts, etc., we could target not only the geographical area, but the age band. And then this is a really important slide. So, there was obviously lots of pharmacy involvement in this, but actually this whole presentation has to be a love song to our communications team. So we are really lucky. We've got in-house communications experts in Dorset. And we approached them with the idea of what we wanted to do and how we wanted to get message patients, but they really helped us craft those messages and work out a system for reaching the maximum number of people within our population. And the message we started with was really simple. We wanted a really neutral message, so just about only ordering what they wanted. We didn't want to make any aspersions or judgments about whether the prescription was appropriate, and we tried really hard to take out any kind associated with receiving a prescription, because we want patients to have their medicines to feel better. We just wanted to cut the waste out of the system. And then we really looked at the messages that sat under only order what you need. And again, we spent a long time working with our communications team to make sure that we'd really understood what patient concerns and misconceptions were. And one thing I didn't realise, which I'd say to anybody here who's looking to run a similar scheme, is that communications teams within the NHS, so like pharmacy teams, they link into other communication teams. And so there's we had a Dorset network, we had a South West England network and a national network. And so they were able to take our questions, the things that we posed to them, out to these wider networks and draw on a huge amount of expertise and resource so that we could really build and really effective messaging for our patients. And so the way that we looked at it, we pulled in all the data and we basically settled on 3 themes. So stay well, stay safe, and stay green. And it's really interesting to know what patients were concerned about and what was driving over-ordering. Within Stay Well, one of the most common themes that came up were people were really worried about drug shortages, which we know is a huge problem. But, people still hadn't cottoned on after the toilet roll experience in the COVID pandemic that actually stockpiling makes the shortage worse. So we used this campaign to reach out and explain what to do and how to make this better for them. We had a lot of patients who were concerned about the safety of medicines at home. And when we started this, we thought actually the big driver will be people will be concerned about children accessing their medicines. And that was true, in fact, but actually when we spoke to patient groups, we found out that people were really concerned about their pets being harmed. So we built that into the campaign. And lastly, there were the group of people that really resonate with us. They were worried about the environmental impact of medication, just being wasted. And we had a really vocal group of patients who were irate that they absolutely looked after their medication, kept it safe, kept it secure and in the right conditions, but were bringing it back to their community pharmacy only for it to be thrown in the bin. And they were absolutely irate about this. So we wanted to reach those patients and help them feel better about their healthcare. And with all of this, we realised that actually we have a wide range within our population. But what we have to recognise is that maybe the language that we would use talking to each other isn't the language that's appropriate for patients. So we worked really hard to get this into simple language. but the overall aim was to make a really a positive reason available to patients for taking this step. So give them positive logic for taking action that makes them feel better about healthcare. It wasn't just a directive from their, their healthcare professionals. Okay. And then we spoke about how we were actually going to reach those patients. So if you think about, we had that information about where the patients were receiving most of the repeat prescriptions. We try to use every method available to us to sort of get the message to those patients. We started with a website, and we kind of had a cascade system of information off of the website. And so we used traditional resources like posters, leaflets, etc. But we also used digital resources, so screensavers in GP surgeries, in community pharmacies, etc. We had a really fun social media campaign, but we also made most of any non-digital product that we could, because we know a lot of the patients receiving repeat prescriptions are elderly. Not all of them have access to digital systems. So we made use of GP newsletters, free press, etc. And then I think was really important, we made use of GP text messaging. So we paid for GPs to send a message to patients with a short bit of text and a link to the website. And then by doing that, we were harnessing the trust that people have within their GP. So they were getting a message from a really trusted source, and not from the ICB, who most patients don't really know about. And the last thing we used, which I'll go on to in a minute, was a smart radio campaign, which was really effective, something I'd not seen before, and completely the idea of the comms team. Okay, so I'll just show you some of the resources. These are table talkers. They just sit on the desk in a GP reception or a community pharmacy. They're eye-catching. They're something that patients can see. And the branding that you see here was used throughout all of the platforms, all of the methods we use for communicating with our patients. And the reason that occurred was because, again, this was comms team expertise. They explained this, the idea of the power of three, and that for a message to really land with a population, with patients, anyone you might have in your family, that we need to have that message delivered at least 3 different times, ideally in different formats, but always using the same branding, the same text, so that message can really bed in and patients can really begin to have trust in the message. And this is particularly important, the literature says, for elderly patients who are very distrustful of messages they just see online. So it's really important that the message reaches them in other ways as well. And this is an example of just free local press we had access to. We really wanted to send letters to patients who, didn't have a phone or something, that didn't have access to the internet. But unfortunately, we had to. That would have been about 40,000 people in Dorset. If you think the cost of a stamp is over £1 now, we just didn't have the budget for that. So all of these newsletters and free papers were really key, we think, to reaching our patient group. And these are hopefully just some of our digital campaigns. And the really fantastic thing about this is if you have digital ways of meeting your patients or getting the message to them, you can track how much they're interacted with, what people think of them, and you'd be surprised actually people leave plenty of comments telling you whether they like them or not, so you could really see what was effective and what was not. And we use that information to tweak the resources as we went along. And we were also able to use this information to tweak the amount of when the resources went out, when they were posted. And we used a sort of data insight to work out on which social media platforms to share them with. So it might not surprise you to know that most of the patients we wanted to reach were older. The most popular social media platform for older patients is Facebook. And so, most of our messaging went out there. Not very many people on repeat prescriptions use Instagram or Snapchat, etc. So for the purposes of this campaign, we didn't use them. But it's something to think about with future campaigns. You might want to target a different patient group. Sorry, they're going again. And this is another aspect of our social media campaign. We undertook a project earlier on in the year in Dorset to find out how patients dispose of their medicine. And when we found out, unfortunately, lots of people still throw them in the bin or down the toilet or in the sink. So we used that information to pop into the social media package for this campaign. Our thinking being, we're going to kill two birds with one stone here. We're hopefully helping people to understand to take their medicine back to the community pharmacy, but then that also provides another opportunity and interaction for pharmacists and pharmacy technicians to talk to the patients about why they're returning so many medicines. And just out of interest, it always fascinates me what people really like. The pink toilet was the most popular social media asset throughout the entire campaign. Got massive interaction, shares, likes, etc. Maybe it's just a bit humorous, but it was the one that really engaged people. And so that sort of helps us go down the colourful fun route for this campaign, and we're going to use it for future ones. And then obviously we have our patients at the end of the campaign, but there's a huge amount of healthcare professional resource that made this work. So it was designed and curated within the ICB, but there was absolutely no way on earth that this would have been successful without our system partners. And so, we co-designed it with our General Practice Alliance and Community Pharmacy Dorset. And that meant that we had buy-in from all of the really important people that patients would be speaking to. We had buy-in from those teams in terms of, what resources they want to use. And then it just meant that we had a ready-made network for rolling out the campaign from day one. And so because of that, because of all the help that we'd received, we wanted to make sure that the campaign was as easy to use for everybody within the system, because they're all immensely busy. And so we made it as easy as possible. As I say, we prepaid the messages for the GPs to send out. We also sent how-to guides for how to use every single aspect of the communications package. And then we ran System 1 data, so prescribing data, every couple of weeks throughout the campaign. And we fed back the results to the people within the system, and it created almost like a positive mini competition, if you will. It generated a competition, particularly between GP practices, and we think that helped the programme along. And this is the outcome. You can see the change in prescription numbers from this year compared to last year. So green bars show a drop in prescription numbers, but this is all per GP practice. Blue bars show an increase. I'm hoping you'll forgive me the two very large blue bars. They were practice mergers who didn't really have time to take part in the campaigns like this at this time. But you can see there was an awful lot of green, and it meant that we had this really dramatic fall in prescription numbers over those 2 months. And this was compared to the expected 2% increase that we were going to see. And of interest, we found that the GP teams that sent out the GP messages saw an average of 4% drop in prescription requests over the 2 months. And we think that's because we were harnessing the GP, the trust, the trusted resource within the community. But we think it's also because those GP teams really spoke to their reception staff, they spoke to their local community pharmacy, made sure that there was a really cohesive delivery of the campaign within their local network. And these are the post-campaign impacts. So we've continued to see a drop in prescription numbers, particularly compared to our regional comparators, which is great. So we think there's going to be a prolonged impact that would gradually fade away over time. But really importantly, we hope to run this, every year. The way that I'm approaching this is a bit like messaging about use of antibiotics for viral colds. It's something that we reintroduce time and time again until that message is embedded in our population. And we're really pleased to be able to say that because we run this in-house, we're not subject to any licensing restrictions. So all of our resources, our digital, our planning resources, the strategy document, etc., they're all freely available. So if anybody would like them, I'll put our contact details in the chat bar at the end. And we'll just make sure that we have all of the information that you need if you want to run it again. So far, we've spoken to about 13 ICBs who are looking to adopt this, which would just be fantastic. And we think this is really important because we think it's got a huge potential. This is information that I took from EPAC2 prescribing data. And if we could reduce the number of repeat prescriptions in England by 2% over just 1 month, that's 2.2 million items with a financial saving of nearly £19 million and environmental savings of 11,500 tonnes of carbon dioxide. So we think it could be absolutely massive. So yeah, please, happy to share all of the resources. We spoke to the Chief Pharmaceutical Officer's team about making this a national campaign which would go through NHS England, but actually the comment was that this would take so long to do. It would actually be far faster and probably more relevant to teams if it was all done ICB by ICB. So there you go. That was a practical learning for me. And just a couple of things to share with you as I finish. This was the impact of the smart radio campaign. And I don't know if anybody else has ever heard of these. It was completely new to me, but you can approach radio advertising companies with your advert, our advert for the campaign. And they will deliver it to smart devices across your chosen postcodes to the households of people that fit the criteria that you're trying to seek. So we know we were targeting over 65s in certain postcodes. We were able to pay for this campaign to be delivered that way. And the red box is really interesting. So the campaign advert was delivered over 80,000 times and it reached nearly 13,000 people. And again, when I first saw this, I thought, oh, that's a bit of a waste. We should have reached more people, maybe who didn't hear it as often. But going back to that concept of the power of three, again, apparently this is received wisdom within the communication advertising teams, that if someone hears it 2 or 3 times, again, they're more likely to take it in, receive the message well. So the fact that we had 13,000 people hearing it multiple times was actually a win. And my very last slide is just some of the lessons that we learned from this, because it was a huge learning curve. And actually, one of the things that's probably not on here that I'd say, first of all, is give yourself a bit of time to get this going. We prepped this campaign in 3 weeks. We came back after Christmas and wanted to start it in February. So it was a really short turnaround time. So if you can, please give yourself a bit more space to do it. But it is possible with that short turnaround. But do use communications teams. They are subject matter experts and they really help this land well with our patients. But also talk to your patients. So in that 3 weeks, I went to every patient participation group that I could physically find. And it was really useful to hear what people were concerned about, what they believed about medication. So speak to the patients within your team, within your area. With regards to engagement with GP teams and community pharmacy teams, there was a huge variation within our patch, and we got some really helpful feedback about why people did or didn't take part in this campaign. Some of the GP teams didn't send out the messages because they were worried about message overload. They didn't want to saturate their patients with a bombardment of information. So it made us really stop and think, what are we communicating to patients? Is it too much? Is it too often, etc. We found that making sure information is sent to a practice is one thing, making sure everybody gets it was quite the other. And actually, there were key people to switch on to the campaign to make a success, and they were the digital care coordinators within GP practices. and the practice managers. So it wasn't just enough to send this to the clinical directors or your lead pharmacists or GP clinicians. It was really make sure the whole team is involved, so that whoever the patient speaks to, they get the same message. And the last point within the engagement thing here is about community co-production. Again, we couldn't have done this without input from our community pharmacy and GP colleagues. So helpful, so important. And then data was, I hope I've explained, was absolutely key to making this program work. So use it to design your programs and to implement them, but also collect it as the program goes along, so you can make tweaks and adjustments and make your program the best that it can be. And then the last thing was, yeah, we're really happy with this. It was a huge success for us as a system. My boss is happy because of the money we saved. I'm over the moon because of the environmental impact. But you know, as healthcare professionals, we have to look at the finance system, and we had like a 47 times return on investment for this. So it's just massive, and it means that we now have authority to run similar campaigns across Dorset, which we're hoping will have, you know, similar effects. And then lastly, what I would say is we've had really positive feedback from our GP and community pharmacy colleagues, not least because actually before we started this, there was a little bit of a niggle between systems. There was friction about who was responsible for the over-ordering. Was it the patients, or was it the GPs or the pharmacies? And we use this to have a blank slate. So it's improved relations, it's freed up work time. And yeah, everybody's really happy with it. So I hope that's of use. I will stop there, but if anybody's got any questions, I'd be absolutely delighted to answer them.
Brilliant. Well, thank you so much, Tracy.
My pleasure.
Amazing. And as you say, like, just such impactful figures, and there's some comments in the chat just going incredible numbers, which is just fantastic. I mean, I really like your use of the communication team and all of those things that perhaps we wouldn't have been aware of, the way there was really positive messaging and that message of the kind of the rule of threes. Really good.
Yeah, it was completely new to us within the pharmacy team, and I think we probably wouldn't have been as creative if we hadn't have had their input. So yeah, it was absolutely brilliant to have their expertise.
Yeah, that seems a great learning point. So there's a question from Rachel. She says, the numbers are just incredible, Tracy. Massive congratulations. And she's interested in how you did a primary care project from a secondary care role, although I think that might have changed, and who your project team were.
Oh, yeah, so I apologise. Yes, I still do work 1 day a week for the local hospital trust, but I now work for NHS Dorset, so the ICB. So that was where our sort of like command central was, and that's how we have all of the engagement and interaction with primary care. However, what I would say is I know that you're in a hospital, and this does have knock-on impacts for secondary care. So with the liberated time, what we've asked our GP teams to do is really focus on structured medication reviews for patients who are at risk of going into hospital. So that's patients on 10 or more medicines, so problematic polypharmacy, or medicines that we know are causing issues in our system. For us in Dorset, that's elderly people with low blood pressure. So, and the number of targeted SMRs has just gone up over the last year for this and for other reasons. And so, although I can't give you the exact figures now, we think this has enabled those teams to do those SMRs, which we know we have data for stops people going into hospital. So we hope it has a whole system benefit.
Brilliant. Thank you. Okay, somebody's got their hand up. Neha Bagi, do you want to just unmute yourself and ask a question?
Hello, hi, I just turned my camera on as well. Sorry, I'm just in my bedroom as my husband's sorting out my daughter. So that was really a great talk. Thank you. I'm one of the GPs and meds management lead at Froome Medical Practice, where we've also done something quite similar, and we're about 2 months in, and we're going to be doing an audit on what impact it's had on, reducing our prescribing. And as you said, communication is probably the key. So I think we spent a good 2 months with our comms team getting the message out. But I think one of the areas, and I wondered how you've sort of managed that, is where some of our elderly patients still rely on our team to issue, to request their repeat medication. And is that something, because you can really educate people to a degree, and then if they just can't do it, then I think our teams are having to put those requests in for those patients. Do you have a proportion of patients, and how do you manage that? Thank you.
So it's a brilliant question. Within the ICB, we don't have any direct patient contact, but we've spoken to lots of GP teams that have similar issues to yourself. And so I guess we were quite practical about it, that we wouldn't reach everybody with this first campaign, like there were still blue lines showing prescription increases. So we've run this alongside a piece of work, trying to get more of our patients signed up to the NHS app, which has really helped. And we've also done a piece of work where community pharmacies have stopped ordering prescriptions on behalf of people, because there was a real feeling amongst GP teams that community pharmacies were sometimes just requesting things without really knowing the patients, or they didn't have the time to really investigate what patients needed. There are many reasons. I don't want to blame anybody. So there are lots of different things going on. The GP teams have worked really hard to get patients using the app, which we have found has helped. But there are still people who are not digitally savvy, can't use the app, still rely on a healthcare professional phone call or popping in. And I guess one of the things we're hoping for this is if it has released a bit of time, then maybe people have more of an opportunity to speak to their patients. And I know one of the community pharmacy teams described it as a sort of a game changer in terms of what they were able to do, because they were literally just drowning under, all these repeat prescriptions. And they said it's actually given them space to do the clinical work and chat to patients. So I hope that might help a little bit, but I'm afraid there's no great easy answer to that, is there? There's just some patients that just need more help, aren't there?
Yes, and I think, after doing it for a couple of months, we now feel that, those who are still ringing, despite, us supporting them and our digital team supporting them to enable them, it may be that with them we will just have to order the repeats, but it is an opportunity where our pharmacy team and a pharmacist can actually, perhaps do medication reviews, structured medication reviews, and try and deprescribe. So, and identify these patients where there might be issues, potentially do home visits if needed, and so forth. So I suppose it does identify a cohort of patients that we could work perhaps a bit better with, which is great as well. Because you wouldn't otherwise know about these people, because it's a lot of people amongst a big cohort.
Absolutely, just thousands, isn't it? Yeah, completely. There's I think every time I speak to a GP team or a community pharmacy team, they all know the patients within their population that need extra help, and everyone's come up with some quite different and creative ideas for reaching out to them. But I think you all know who they are and what they need. Yeah.
Great, thank you. I didn't know whether you'd sort of thought of anything.
Oh no! If I find the magic solution, I'll definitely get in touch.
Please do, and if I get there, I'll share that too.
Thank you so much. I would love that. That'd be amazing. Yeah. Thanks.
Thank you.